Thank you, ma'am. A very good afternoon to everyone present here. I'm Hiba Mohammed Hashim, second year Masters in Hospital Administration student at Prasanna School of Public Health, MAHE, Manipal, India, and I will be the moderator of today's webinar. It's my honor to welcome all the participants from 20 different countries to benefit from the fifth webinar organized by the Manipal Health Literacy Unit, known as MHLU, in collaboration with the Asian Health Literacy Association, known as AHLA. MHLU aims to excel in health literacy resources, policies, and practices. The AHLA seeks to understand health levels across Asia from research, educational, and policymakers' perspectives. Collectively, MHLU and AHLA are initiating a webinar series on health literacy for healthcare providers, researchers, policymakers, industry, academia, and the public. Before I invite the first speaker of today's webinar, I have some important requests to the participants. A small request to the distinguished participants to kindly mute your cell phones and the mic. You may post any queries or questions during the session through the chat box. We will be addressing a few selected questions considering the time limitation. In today's webinar, we will be hearing the insights from experts on promoting smart lifestyles, role of health literacy, and health literacy for women in their life goals. Please note, the speakers will be sharing their insights for 15 minutes. It is my pleasure to introduce our first esteemed speaker of today's webinar, Dr. Arathi Rao P. Dr. Arathi Rao P. is a gynecologist by qualification and a public health professional by practice. Her area of expertise is maternal and child health with a special interest in adolescent health. She is a medical doctor with a diploma in obstetrics and gynecology, following which she completed Masters in Public Health with epidemiology as specialization at Manipal Academy of Higher Education. She has pursued her doctoral study at MAHE on gynecological issues among adolescent girls with cerebral palsy. She was selected as a global health in 2022, and she has conducted exploratory research on lived experiences of the double burden of cardiac disease and COVID-19 in the coastal town of Udupi, mentored by Dr. Purnima Madhivanan from University of Arizona and Dr. Jurit Narona from MAHE. Currently, she is heading the MPH program as the coordinator at Prasanna School of Public Health at Manipal. She is also the MAHE coordinator for Global Health and Humanitarian Medicine course for South Asia in collaboration with Medicine Sans Frontiers. She has been a recipient of the Erasmus Plus International Credit Mobility Grant and has visited Tampere University in Finland and University Medical Center in Groningen, the Netherlands. She was inducted for leadership training by MAHE in 2022 through the Synergic Manipal Integrated Leadership Engagement and Strategic and Innovation Capacity Building Program. She is a co-investigator for a multinational project titled Prescriptech, funded by DBTH 2020. She has also been the WHO External Monitor for the Pulse Polio Program. She was also selected as an external monitor for the Special Newborn Care Unit at district hospitals all over Karnataka. Her passion is academics and research. She has given guest talks in several schools on menstrual hygiene and its practices among adolescent girls, addressing women's self-help groups on the relevance of cancer screening along with the initiatives available in the local area. She has conducted health education workshops on women's health issues for women employees of academic institutions. She was an active member of Team Women MAHE. She gives regular talks on community radio on various health issues related to women, public health, and global health. She has publications in national and international journals. Women's well-being and leadership are close to her heart, and women's health has been her forte for academics and research. Share her insights on today's topic. Over to you, ma'am.
Thank you so much, Himba. Am I audible?
Yes, ma'am, you're audible.
If I knew this, I would have cut short my CV because I think out of the 15 minutes, a good 5 minutes is going on for the introduction itself, which is a sorry thing. Anyway, I'll try to cover, do justice to the topic I chose to speak today. Once again, a very good morning, good afternoon, good evening to everyone, because I think we are behind you, even though we are on Chandrayaan. So the topic I chose today was, I see hello? Hello? Am I audible now?
Yes. Yes. Now we can hear you. Yes.
Okay, sorry. I think there was a catch with the internet, so it's funny always. Yeah. Okay. So once again, good evening, good afternoon to everyone, and it's a pleasure always to connect to Asian Health Literacy Association and a Manipal Health Literacy Unit. Thank you for this opportunity to share my thoughts on importance of health literacy for women across the life stages. So these some of these points which I would like to put it across in today's webinar is based on some of the research I have conducted and also some of the literature search to keep abreast with what is the world thinking as far as health literacy for women is concerned. Now, I think Mandy already said, and then Angela also agreed that how do we define health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic information and services needed to make appropriate decisions regarding their health. So I think as agencies for health literacy, these three catchwords should be the mantra, like obtain the information, process the information, and understand so that they have the capacity to take independent decisions as far as their health is concerned. And that should be the mission and vision of the health literacy organizations across the globe. And research has also shown that various social factors like income, education, age, all these things could influence the health literacy of a person. We have seen across the nations, across the continents that health literacy is found to be lower in populations with lower incomes, with lower education and older ages. And thereby they have faced difficulties in navigating healthcare and treatment routines for their diseases. Now, if we look at the national program for India, previously it was called as the Reproductive and Child Health Program. Then we renamed it as Maternal Child Health Program. And now we see it as Reproductive, Maternal, Child, Neonatal Health and Adolescent. So I hope I'm audible because I'm keeping checking because of the internet being funny sometimes. So I think I'm audible. If in case I'm lost, Spruti can message me or something. So just like the national program for India, program proposed by India for maternal child health, they have taken one step behind. That is, today's healthy adolescent is tomorrow's healthy mother. Because we have huge maternal mortality, it is always a big challenge in low and middle income countries. And there was some sort of a revision in thinking, and so they took a step backwards. So in today's talk, what I would like to emphasize is across the age, because this is life course, how health literacy can be provided, or the information can be provided, how is it processed, and how it can be applied across the life course of women. And that is why, as a part of the mission and vision for the health literacy organizations, it is good to focus early, especially in case of women, because women and children are considered as vulnerable sections of the society across the world. One important term which I would like to introduce through this talk is cognition. So cognition is a mental act in which the information that is absorbed is well thought and appreciated through experiences and senses across the age group. So we also saw that social factors like age and education, everything influences health literacy. Definitely cognition also influences, because if there is a good cognition, you can expect good health literacy among this women population. So what happens is when the information that is provided at early age, how much of it is perceived, how much of it is imbibed, and later when they become mature adults. Hello? Am I audible?
No, you're fine.
Yes, ma'am.
We can
Yes,
hear
ma'am,
you.
you're audible.
Yeah.
Okay, right. Okay. So how much of it is absorbed and applied when the woman becomes a young adult and then an older adult, and then in the later in senility and older age group, senior citizens, and in the peri and the postmenopausal age group. So again, this cognition keeps on fluctuating over the ages. What is absorbed as an adolescent gets applied probably with high chances as a mature adult woman, and how much of it is retained as she processes, as she crosses this across life course is something which is worth taking a study, and perhaps we might have taken it as a cohort study or a parallel cross-sectional studies in which we can observe and identify. The reason I see is that I say this particular thing is because whatever data we have regarding the prevalence of health literacy or any aspect of health literacy, we don't see much of a gender disaggregated data. So there is a combination of both men and women go through their own processes for becoming health literate, and which influences their health literacy capacity. And any studies which is directed towards a gender disaggregated data can give a better picture about what is this health literacy status for women, and how it is relevant is what we're going to see in the future study, in the future part of this talk. Now, as an example, which Hiba was telling as a postdoc study, my postdoctoral fellowship was funded by the National Institutes of Health USA, where we did a research project on lived experiences of the double burden of COVID-19 and cardiovascular disease among women in the local context. So what we found in this study was women were more health literate, and technically education and dosings, though even though the sample size was small and it could be hospital based study with a focused population, but still the compliance of women, the adherence to treatment for women, especially after the disease sets in, is far better for women compared to men. And then it was not necessarily being influenced by the education status or the general literacy status. That was one of the very interesting finding for our research project. However, studies across the world have shown that factors have influenced health literacy and it differs by gender. For example, uneducated women were more compliant and they were more socially responsible. Then what are those factors which play? Can we just brush it under the carpet telling that general education and age and what are the social factors, income, access? Because it is the attitude of the person also plays a very important role to remain health literate and to make the right choices across the lifespan. Now, one other thing which comes to my mind when I say about health literacy for women is, a simple example like reading food labels. So women do better. Women do better reading these food labels because of the gender roles in nutrition. We know, I mean, especially in the low and middle income countries and the societies and communities, it's a woman's job to put the food on the plate. So it is they who are looking into the foodstuffs that goes to the family. And when the survey was done regarding the interpretation, reading and interpretation of food labels, women seem to fare better. So this is something again which has to be sat up and taken notice of, and this is contributing to the health literacy of this population. So that is something. Now this was about the cognition. Now when you coming to specific domains for women, so far science has advanced, technology has advanced, but women still contribute to the reproductive, to taking the population ahead for all the reproductive functions of societies and communities. So one of the things which can think of is what is the relation when we see the reproductive health across the lifespan, as she enters puberty, menarche, and enters into adolescence and later into young adult. One of the requirement of today's fast life is contraception. And what is the idea about fertility? Just yesterday, I was reading through literature and was very happy to say that it was found in the Grey literature that 77.5% of adolescent girls and young adult women in India have access to modern methods of contraception. This is a combined analysis of the National Family Health Survey 4 and National Family Health Survey 5. So this is very heartening to say. But access is there, but how much of it is continuance, how much of it is dropout is something which needs to be seen. But at least there is a transition in time compared to our previous generations that, the knowledge of contraception and the access has already been reported through the family health surveys. Now, the next important thing about women is planned versus unplanned pregnancies when we are talking about reproductive health. When we take this topic of unplanned pregnancies, it is a continuation of the role of contraception. So which is the best contraception? What is the failure rate of the contraception? And how is it going to impact her health if she's not careful or she does not choose the right thing for herself? So this is again very important, and health literacy definitely seeps in when you are thinking of these ideas. So it again percolates to the fact of their sexual behaviors, sexually transmitted infections, So most of the times what happens is in conservative societies, there's a lot of stigma to discuss about these things. So what is the contraception and, how to choose, what is good for oneself, So we see that is very much there, but there is always access to information, to technology through, through internet surfing and all these things. But how to make the right choice? Again, health literacy plays a very important role. And as I said right from the beginning about the cognition, the gradual coursing and reinforcing of the health related information when it comes to all these women, that helps along with the internet interface to make the right choices for themselves so that they can, take care of themselves against risky sexual behaviors and also sexually transmitted infections. If that is about unplanned pregnancies, then one other thing is like, they are not, this is again health literacy is to take the right decision for themselves, avoiding formal healthcare and going to informal healthcare and not making the right choice, landing them in other complications like infections and infertility, all these problems galore. Again, you can pin it to health literacy. When you come to the planned pregnancy section, then a woman has to comprehend what is the necessity, what is the need for prenatal medications and supplements, and what is the belief, what is the use. This all has to be tackled with. Just now I told about the National Program of India, which is towards reproductive health and pregnancy and postpartum and all. So there is no point in the program pumping lot of money and lot of resources into this unless and until why we are not able to achieve the indicators what we want to. Again, health literacy, it joins, it binds between these programmatic interventions and initiatives, and the uptake by these participants. Health literate women is very, easy to convince, easy to counsel, and makes the right choice when it comes to prenatal medications and supplements, which has got its own implications on the pregnancy outcomes and also the postpartum outcomes. Postpartum depression, that is again a major problem which is in the modern societies, which is happening there very subtly, sometimes taken notice of, sometimes not taken notice of, sometimes lead to morbidity, mortality and all, and then making the right decision, going to the right person, going to the right contact, expressing what is happening within the person, that is very important if you have to deal within the right way to deal with these problems related to reproductive health. And again, some other lifestyle factors like smoking, alcoholism, drug abuse, all these things, in women, and what is its implications and as an adolescent girl, as a young adult, and again as she progresses, because this is all related to cumulative risk factors, ultimately leading to lifestyle diseases like cancers, diabetes, hypertension in the later part of life. So it is a course. That's why I chose this topic as a life course, and the importance of health literacy across the life course, so they'll end up doing the right decisions for themselves. One other thing that comes to my mind is India is looking at a huge increase in cervical cancer. We have the National Cancer Registry Project, which says that by 2025, India would be leading when it comes to the cancer burden across the low and middle income countries. So we have a huge problem to tackle with. These lifestyle diseases, especially, this is something which is a lifetime disease. Lifestyle diseases are lifetime diseases, and they require continued treatment. And unless and until they are health literate, they might drop out, and they may not necessarily take the necessary medication and approach the right person possible. And next, we then go to the postmenopausal age group. In most of the low income, India is a country where the age pyramid is expanding at the top. That what I mean to say is the life expectancy is increasing over the top. With the life expectancy increasing, do we have the necessary social security systems to balance the situation? So increased chances of diabetes, hypertension, cancers, cancer screening, cancer diagnosis, the appropriate medications that is to be required to tackle this situation. So yes, in one side there are interventions and initiatives to increase the life expectancy of the population, but do you know how to cushion that, how to balance it? That's what is happening. So instead of blaming the government, can an individual take the right choice for themselves? Just like I think Duong is going to talk about lifestyle factors and then health literacy in the role of lifestyle factors. So I'm sort of connecting to the topic what he's telling. And again, the leading causes of mortality and morbidity among women: cancer breast, cancer ovary. So for cancer breast, for better prognosis, we have screening measures like self-breast examination, clinical breast examination. So all those things, you have a high degree of suspicion, and that can happen only when a woman is literate and a health literate. So there again, the concept of health literacy percolates. Now the pandemic has thrown its own spanner, So like we saw what it was, for example, the second wave had a devastating effect as far as India was concerned, and we are still reeling and recovering. The census which had to happen in the country by 2021, we don't know when it's going to happen. Many national programs have been stalled. All the money has been used for vaccines, and then research has some sort of like taken a backseat because we need to get up and bounce back to the situation what it was previously. We don't know the current indicators. So these sort of, when a pandemic situation where it throws spanner into the routine system, functioning system of the healthcare delivery scenario, health literacy and doing and performing and delivering at an individual level, at a familial level, societal, ultimately contributes to the larger picture of the nation doing well when it comes to, and that again essays portrays the relevance of health literacy in these situations. One last thing, I don't know how much time I have. I'm sorry if I've exceeded the time limit that is given to me. But one last thing which I would like to say is that financial literacy is very closely coupled to health literacy. Health literacy is fine, but then we don't have the necessary social security systems where health is free. Health services are free in certain countries, and coupling health literacy with financial literacy goes a long way in making women independent and make the right choices as far as their health is concerned. Thank you very much, and I'd be very happy to take a couple of questions. I'm sorry if I've exceeded.
Thank you so much for your enlightening talk, ma'am. So let me introduce our second speaker of today's webinar, Dr. Tuyen Van Duong. Dr. Tuyen Van Duong is currently an assistant professor at the School of Nutrition and Health Sciences, Taipei Medical University, Taiwan. He is the elected chair of the Scientific Standards Committee and EB member of the International Health Literacy Association in Boston, USA. He has been invited as a yearly guest lecturer at Tufts University School of Medicine since 2018. He is an active member of several international organizations such as Nutrition Society of Taiwan, the American Society for Nutrition, etc. Dr. Doon has developed a strong academic background and a wide international networks. He has been closely working with other scholars on several research projects and has also collaborated with the Research Consortium in Europe and with a growing number of institutions in Australia, United States, and Africa. By March 2023, Dr. Doon had published about 60 original research articles in 30 ISI journals. He has received 15 honorable academic awards from national and international organizations. Now, I would like to request Dr. Tuyen Van Doong to share his insights on today's topic. Over to you, sir.
Yes, first of all, thank you very much for the Manipal Health Literacy Unit in Manipal, and also thanks for the organizers, including Agla, and also for the moderator, Professor Peter Chang, and also the MC, Scotty, and many others, key members, Agla, and also the MHLU. So I'm very pleased to share and enjoy learnings from other speakers, and also waiting for the question. And today I'd like to introduce a term, is health literacy. Last time I shared this, and Professor Peter just say it should be smart lifestyle, because we live in the digital world, and we have to be smart. And what health literacy can contribute to, promoting this smart health healthy lifestyle. Okay. I just have some slide here. You know that the NCDs kill a lot of people, 41 million people each year, and equivalent to more than 70% of deaths globally. And these deaths happen two-thirds of them, more than two-thirds of them in the low-middle countries. And among those four key factors, four key NCDs just now mentioned by Dr. Rao, cancer, respiratory disease, diabetes, and also CBDs, right? And she also mentioned that lifestyle factors, some of that, tobacco use, physical activities, harmful of the alcohol consumption or unhealthy diet, can have to increase the risk of dying from the NCD. So detecting, screening, and treatment at the NCDs, as well as the palliative care, are the key components of the response to the NCDs. And that is the NCDs. Now, we talk about lately COVID-19, right, or other general communicable disease. So I show here is 6 of my publications since 2000 and 2020. And we studied some of them. And we found that this health-related behavior can contribute to improved mental health and quality of life during the COVID-19. In the healthcare worker, in a patient, in students, we conduct this in quite vast populations, and we found that not just only contribute to the mental health but also physical health, right? And with that we know that health-related behavior, or sometimes we say it's a lifestyle factor, is really important to contribute to improve people's mental health and physical health. Right now in United States, so this one American Heart Association proposed and already put this into guideline. Very simple way to improve people's health, right? Manage your blood pressures, control the cholesterol, reduce blood sugar, eat better, control the weight, get active, and stop some of the harmful substance. Right? Stop smoking or alcohol or some other thing. So with this simple message that people can know how they can control their wealth to improve their health in general, and also cardiovascular health. Right, so there's another emerging term that we say a healthy lifestyle, and what are the key components. So this American College of Lifestyle lifestyle medicine proposed 6 key components here, including the first one is healthful eating, physical activities, stress management, and also improve the relationship. And especially another one is the sleep quality. I try to improve that and try to avoid some of the harmful substance. And with that, we can promote our lifestyle. And also, during these worlds, we have to be living in the smart way. So smart healthy lifestyle become important in our life, right? So with that, the question is how we can come together and amplify healthy lifestyle. We know the lifestyle is important, but how? So over here, we propose 12 stakeholders, right? The first one is start from the professional organization and how the professional organization can help to promote healthy lifestyle, right? So this have to be the one to advocate, to be the champion of healthy lifestyle through the leader, and also this have to take the responsibility to disseminate the scientific knowledge and practice guideline professional meeting. Government organizations have to create and support and implement this healthy lifestyle initiative. NGO, right, and also other non-profit committee organizations have to also advocate and create and so support and implement together with the government. Health insurance industry need to provide the mechanism, right, to pay the healthcare workers, right, to have some good mechanism that everyone would like to promote healthy lifestyle. Media outlets also have to disseminate the reliable, accurate information on the healthy lifestyle. Right? We heard a lot about disinformation. So our media outlets also play very important roles in the smart world now. Right? Education system need to provide the training curriculum, right? Put the lifestyle into the training. Employer need to create healthy lifestyle environments within the workplace, offering the program for employee. Health fitness industries also important, provide infrastructures, professional capable of offering the healthy lifestyle program to the public. Healthcare organizations need to integrate all of these together into some of the medical models as a standard care, because we need to start from not just only community or the other stakeholder, but the healthcare organization play the key and very important roles. Now, mobile health and technology company need to bring this technology advance to support healthy lifestyle. We know that many technology now have to promote healthy lifestyle, but they bring, along with that, they bring some of the bad habits. So other stakeholders have to get involved. Key important is that food industries, right, need to make the healthy food choice available and providing health conscious nutrition labeling. Right, so this is 11 stakeholder. The key stakeholder is in the center, which means the users. This 11 is just to provide the services. However, the user need to know that and need to use that and it's work. Otherwise, you produce very good PC or laptop there, but no one use that. It's not good. Provide very good facility in the community, in the public areas, in the park, but no one use that. It's useless. So how to promote, right, the consumer of this healthy lifestyle initiative, right, from the individual level to family and even to the global population, right? So the question here, we lack of something in these models, right? Which is, you may guess the answer, right? That is the health literacy. This could help to connect the provider and consumer, right? In this way, we can promote a healthy lifestyle and improve people's health outcome, right? So that is my key slide and information I want to share with you, very brief. And I'd like to receive some of your comment and question. in the discussion session. So with that, I'd like to close with the new, conference next year in May 2024 in Ho Chi Minh City. So please follow us and also submit your abstract to the conference organizers. I'll be the chair to this conference, and thank you.
Thank you, sir, for sharing your valuable insights on the topic. Now I would like to invite Professor Peter Chang, who has served as an honorary and was also the past president of the Asian Health Literacy Association. He has also held the positions of former vice president and director of the Council of Presidents of the International Health Literacy Association. He currently serves as the international director at Sichuan Health System in Taiwan and is an adjunct professor at Tufts University School of Medicine. Today, Professor Peter Chang will be the moderator for the panel discussion. Over to you, sir.
Well, thank you so much, Sporty, and also thanks to very important speakers, Dr. Rao and Dr. Tuyen. I would ask Dr. Tuyen to mention about your last slide later on about the 10th ACLA, because some of the audience today probably the first time, and they've been in the ACLA Manipal webinar for a couple of times, but they didn't attend previously ACLA conference. So would you be so kind, Dr. Tuyen, to mention a little bit more how to participate in this coming ACLA conference, and what are the main interests of this conference? As we know that also Manipal is going to hold 2025 ACLA conference. So I think it's important that we sensitize this conference of the ACLA. All right. So I will leave that to you in the last few minutes, if you like. So we are open for questions and also comment from all the audience. I know we have quite more than 100 participants in this on this webinar now. Probably I cannot respond to all the requests, but you can write your question or comment or someone you expect to respond to your questions on the chat box. That might be easier for both of the speakers. So we are open for any questions, but actually I'd like to volunteer to ask the first question to Dr. Rao, which is very, very important regarding female in the community, regarding their lifestyles. In previous research, we find there were different interaction regarding health literacy and communication on health information between men and women, very much in many of the studies. And I'm very pleased that you mentioned that how to disseminate the information, the sharing. Are women more in the voluntary? They are more like to share than men? But my question is that how do you suggest women, they can communicate with men? Maybe easier for women to communicate with the way, but I find could be very difficult in different culture and in countries that how women can more effectively communicate means that practice the health literacy to men in different perspective. Could be in their working environment, it can be in a family, community, and etc. Would you like to share your wisdom with us?
Yes, thank you so much for this very important question, Professor Peter Chang. One of the things which women have to address for themselves is, to remove the shyness in them to talk to people. Because there is so much of cultural conditioning that happens since childhood in conservative societies, talking to men, and they're brought up like that. Now, what is happening is societies, they are undergoing a transition. So what I say personally feel is that when the literacy improves, the confidence improves in the women to talk to men. They are more liberate and they are more confident, and they have the morale to talk and discuss issues related to, about the health, to get information about health, what is right for them and what is good for them. So basically, if you have to promote communications between men and women, first thing is literacy has to improve, or the confidence. You have to work on those factors which is going to improve the confidence among women. It could be small steps like within the family, between brothers and sisters. You should promote communication between neighbors, promote communication, co-ed schools, promote communication. So at go, if you want to produce, if you want an intervention in a large scale in a community, it's not going to happen. So I think you have to go in stages gradually, because that is why I brought upon the term of cognition when I meant. So this is how it forms. The opinions forms through the ages across the life course. And that's what happens, and that's what influences the health related decisions that is made. So I think personally, to bridge this gap of communication between man and women has to start primarily in the families, in the neighborhood, in the communities, in the schools, in the colleges, and gradually I'm very sure it is going to spill over to the societies, and communication channels will open. Yeah.
I know there's a question from Dr. Ram Prasad, but I would like to, being a moderator, I have a slight advantage to ask one more questions. You mentioned about a family communication pattern, but we don't learn, we don't learn how to be a parent when they communicate on health. Do you have any, as a leader in this area, do you have any suggestion as a future parents or coming parents in the family, they can lead this kind of health communication between family members, between the parents and the children?
That is the role of a community health worker. So that is what we have to start at the grassroots level. And this sort of bridging the communication gaps is one of the important aspect of health missions, which is there, and health programs that is there in the country. I'm sure Ram Prasad is working on tobacco projects related to that. And health communication is so very important. If you have to bring about a attitude, it will change. We are talking between men and women. So this has to, so now we offer contraception to eligible couple, right? That is basically to plan their families. So perhaps you could also preach the importance of literacy and health literacy and communication at the grassroots level itself, so that these couples who are going to become parents later on in their lives, they can bring about these changes in a small, and everything, little drops of water make a mighty ocean. This is going to bring about a huge revolution in societies, is what I feel.
Thank you so much. I would leave the next question coming from Dr. Ram Prasad from Manipal also. Instead of reading your question from chat box, do you like to raise your question, and who do you like them? One of the speakers would like to respond to your question. Dr. Ram Prasad.
Yeah, thank you so much. Yeah, thank you so much. A warm greetings from the Department of Public Health Dentistry here. Dr. Tuyen, Duong, thank you so much for your insights. Pleased to get the finer inputs and insights. I just wanted to know whether any tool has been created with a hierarchy, to assess the barriers in relation to health literacy. See, it's a very important area to find out what actually are the barriers before we try to address those barriers. So you have different gradations of barriers. It could be psychological barriers, it could be physiological barriers, it could be domestic barriers, it could be local community barriers, it could be related to communication, as Professor Arathi just now mentioned. So is there any hierarchy? Is there a possibility of a tool being created first to assess what are the barriers to health literacy in a particular population before we try to address it? Thank you so much, sir. Thanks a lot.
Dr. Tuyen, please.
Thank you very much, Dr. Ram Prasad. This is interesting question, very interesting. I think no one asked about this question before. That is barrier to health literacy. For me, the answer is the tool to measure health literacy is not really the tools. It should be the broad view. Just the one you just mentioned. Sometimes, if we study deeply in health literacy, one other factor is that some people have a higher health literacy, but they have a bad health condition.
Right.
Why?
Right.
Because health literacy improves after they have disease. So healthy is also the barriers, right? This is the put in the very smart way to healthy people. For example, young people, they're healthy, they don't have any problem with their health. You can ask them everything, they say, I don't know. Your kid, right? Your kid, they say, I don't know, but they're healthy, you know,
Right.
they're healthy. So sometimes healthy isn't a barrier. However, we need to educate them, right? And so we run several analysis and publish different paper. So we say, what are the predictor of health literacy instead of barrier to health literacy? What are the predictor? And we found that just so many factors influence, impact on the health literacy. Social factors, health condition, behavior factors, many other factors, right? And I hope that in the future, if we have very big database, we can run using the machine learning to predict, to build a model. And at that time, we may have a very comprehensive model to see what are the barriers. But if you go back to the original framework, right, and you can easily to see what are the factors, right, from the individual factor to population level factors, right, and sometimes from the individual level, and so hospital, healthcare system, right, the government, all of that is a barrier, and also enhance the factor for health literacy. So I hope that this short answer can respond to some
the context. Yeah, the context and the background of this question is, see, the health literacy environment needs to be a nurturing one. See, when we're looking at the health literacy environment which you are talking about, until and unless it has a nurturing component to it, the health literacy message is not received well. So it will have issues in relation to its implementation. So creating a health literacy environment or nurturing health literacy environment is what I was looking at. That was the context of the question, sir. Thank you so much for your insights. Great learning. Thank you so much. Wonderful to be a part of this.
Thank you. And actually now, Dr. Chantel also mentioned about one of the tools to measure organizational health literacy. And also organized health literacy also have several tools to measure that. And some we use to measure the individual health literacy. Yeah, we have one of the website, we collect more than 200 survey tools we post on the website. And that managed by one professor, Michael Pacello. Now he moved to the Tufts University, and he will share with that. And I hope that one day we can invite him as a speaker, but he will not be the member of ACLA. Maybe in 10 ACLA we can invite him. Yeah, 10 ACLA conference.
Yeah, thank you so much. Thanks a lot. Thanks.
We have an intervention from Dr. Chandela. I'm wondering, you are with us. Do you want to elaborate your question or your comment, Dr. Chandela or Dr. Chandel?
Yes, I can. I was thinking when you were saying about the barriers to health, and I was thinking more about like something like that measure of the health literacy questionnaire helps us to understand people's strengths and needs in health literacy, but all those things that you talked about, the other speakers talked about, about how this other social and what motivates people to take action are really important, and also the different experiences that people have. So like you're saying, somebody who'd never had heart disease before will learn about heart disease and become more understanding of those things. But there are barriers to how much they understand it depending on all the other social determinants. So I think lots of research has shown that education is a big predictor of health literacy. So those things tend to go hand in hand, where health literacy is an outcome of health education, but also helps people to learn as well. So it's an interesting phenomenon, but it's a really interesting
Apparently, Dr. Shander's connection is not so good, but I think we hear her comment and feedback. I'm wondering, Dr. Rao or Dr. Tuyen, you want to respond regarding her commentary? Well, at least I know that Dr. Shander is from University of Tasmania, and you are very welcome. So any comment from both of the speakers?
Yeah.
I could
Dr.
not.
Rao, please. Yeah.
I couldn't hear her much because of internet issues. So I would say if Duong has something to say, to please go ahead.
Yes, we cannot omit all of that factors, also determining factors and also other health and also behavior factors to influence health literacies. But in practice, in many cases, right, and even us, as a healthcare provider, and sometimes we cannot know one of the things until we have something. So we start to have a time and we spend more energy to search for the information. And agree that education, for example, is a very important factor. However, many people with a very high education, sometimes we have, even we do the survey in the school principals, there's still very high proportion to have a low health literacy. Okay? And also in some other analysis we already published, very big data, education sometimes play less important roles than some other. And traditionally, yes, education is good. However, now health information is updating, dynamic, diversified, and it changes all the time. So with the very basic education levels, and you don't update, right, then one day the knowledge there was not usable, right? And sometimes it's even harmful. We still agree that health education is one key factors. If people train well, they have ability to read more and understand more and just all of these abilities for getting the correct information. So yeah, it's interesting to discuss about this. So thanks for raising this comment.
We have only very short minutes ahead, and I promise that Dr. Tuyen is going to talk a little bit about the coming ACLA conference. And can I give that to you? And then we'll come back to the last remark from both speakers.
Yes, thanks for giving